ECG interpretation or electrocardiogram interpretation. Electrocardiography. So the resting ECG, you can have a base to apex lead, this is most used, and you can also have the Einthoven lead. The Holter and telemetric ECG, these are used during natural work on the treadmill. The basic steps of interpretation. Number 1, the overall quality. Artifacts are quite common in equine ECG. Number 2 is the heart rate. Number 3 is rhythm, the RR intervals. You can have normal, regular, irregular, such as arrhythmia or atrial fibrillation. Number 4, the relationship between the P waves and the QRS complexes. Is each P wave followed by a QRX complex? Is each QRX complex preceded by a P wave? And the duration is number 5, on the morphology of the waves, and the duration of the segments and the intervals. The equine base apex lead ECG does not typically have identifiable Q waves. The BQ interval becomes the PR interval, the QRS interval becomes the RS interval, and the QT interval actually becomes the RT interval. Because the largest deflection in the equine QRS is negative, this is called the S wave. The interval measured between the QRS intervals is actually called the SS interval rather than the RR interval. But in most instances, the intervals are called PQ, QRS, QT, and RR for simplicity. So the sinus rhythm. The normal sinus rhythm has a low frequency. The P wave is normal, that it is split up. The S or R wave is visible and has a negative reflection, and the T wave appears later and has a positive reflection. The atrial depolarization. This is an early P wave. So it's a common arrhythmia. It causes exercise intolerance. The P wave is coming too early compared to the previous ones. So the P wave is immature in atrial depolarization. In atrial fibrillation, there is no P wave. It's the most important arrhythmia. It causes exercise intolerance. There's a lack of P wave, and there's no visible P waves. And the first degree atrioventricular block. This is a delay. So all first degree atrioventricular blocks are physiological in horses. Same with most second degrees also. They're caused by high vagal tone of the vagus nerve. This slows down the heart. The second degree, these are also normal in horses. Second degree atrioventricular block can still be normal, but it disappears with exercise. And a third degree atrioventricular block, this is no signals at all. There's a complete lack of exercise tolerance. There's a complete level of exercise tolerance, and there's a complete separation between the atrial and ventricular depolarization and repolarization. And the treatment is a pacemaker implantation, which is possible in horses. And then you can have a ventricular premature complex. There's an OP wave every second cycle. And then the ventricular tachycardia uniform. This one, the resting heart rate is 140 to 150 beats per minute, and it's monoformic and continuous. And then you can have the ventricular tachycardia, which is multiform. The animal is probably going to die, and there's immediate treatment needed.